Good morning. My name is David Baum, and like Angela and Carl, I'm a volunteer member of the Board of Directors of Parkinson Social Network. PSN is an organization that is focused on the lives of those whose lives have been affected by Parkinson's disease. And we support you through conducting a series of events, including the webinar today, to try and provide you with assistance and a method of advocating for you and educating those whose lives have been affected by Parkinson's disease. PSN is an organization, it's a 501c3 charity based in Northern Virginia. It has no paid employees. We are just 5 volunteers who do all the things behind the screen, like the Wizard of Oz. Today's webinar, Angela and Carl will introduce our speaker, Dr. Maria de León. So I will turn the meeting over to them.
Thanks, David. I'll go ahead and start. No, I got it. I'm going to read her formal introduction, and then it's long, but you know we'll make it short. Okay. Maria de León is a retired board-certified movement disorder neurologist diagnosed with Parkinson's disease in 2008. She spends her time involved in related activities, as well as well-respected and well-versed in the resource of Parkinson's disease. She is a consultant and frequent guest lecturer. She is today a research advocate and for the Parkinson's Foundation, and a research volunteer and public policy advocate for the Michael J. Fox Foundation. She's also a member of the Women in PD initiative.
And in 2013, she was the recipient of the Association of American University award for her working in the first step.
I know, that's okay.
In the field of her time.
Okay. Over the last decade, Maria has spent most of her time championing women's issues and setting ground for the understanding of gender differences in neurological diseases, particularly Parkinson's disease, while attempting to decrease the disparity in healthcare treatment among minorities through her work as part of the PAIR Parkinson's Advocates and Research Program. And Carl and I have had the pleasure of knowing Maria. I don't even know how many years. Maria.
No, a good 6, 7 years at least. I don't know. It's been a while. Time flies when you're having fun.
Exactly.
Yeah.
And we haven't aged a bit. That's
No.
the other.
No, of course not. I'm still 25. I don't know. You're 20. So, you know.
Exactly.
So.
Carl doesn't seem to age himself.
No. He is awesome. He's gone backwards. He's like
Yeah,
Benjamin Button.
exactly. Parkinson's
So-
made him younger.
Yes.
I got all the gray hair.
Let's not talk about that.
Okay.
No.
Well, Maria, and the one thing we did not mention is you're the author of 2 books, which if everybody can see it, Parkinson's Diva is the women's guide to Parkinson's disease is her main book, and then she has a workbook that's kind of associated with that, a journaling book. But Maria, for the folks who may not be familiar with you, can you just give us a little bit of information about your journey through Parkinson's?
Hi, thank you. Good morning to everybody for being here this early morning. It's early for me, so early for everybody. I really appreciate everybody tuning in and all the work that Carl and Rob and all the volunteers there at PSN do. I mean, it's just wonderful, and I'm really honored to be here. Yeah, we've known each other for a while. I don't know how long, but it seems like, you know, we've become friends since the beginning. But it's interesting, you know, as Angela said, I went to medical school to become a Parkinson's specialist, which is kind of funny that I ended up with Parkinson's myself in a personal journey. First started with my grandmother, who I diagnosed when I was still doing my training. She fell and broke her ankle and she lived in Mexico, and she came to Houston to get, treatment. And I took one look at her and I said, my God, you have Parkinson's. That's why you fell. So that started, that more personal journey. And she lived with Parkinson's about 15 years before she died. She had a brain tumor. So she died secondary to a brain tumor, but was bedridden the last, year of her life. And I was her caregiver. So being caregiver to somebody that was neurologically impaired really put a different spin and perspective into what it's like living with somebody with the disease and caring for somebody. And for a while there, I felt like I was in a madhouse. I was dealing with patients in the hospital that was psychotic. I was coming home to psychotic grandmothers. So it was just like psychosis everywhere. So, so I was like, and I had a toddler of 3 years old at the time. And so dealing with her and had a busy practice, and, I would not have survived those days if it had not been for the help of my husband. It was always been, my right hand and support. But, she was bedridden. And so learned a lot about taking care of somebody that's demented, psychotic, firsthand 24 hours, because, during the day, I had somebody stay with her, but I took care of her at night. So I was a primary caregiver while I was on call, taking care of my daughter and being her caregiver. And so we learned a lot. And so I learned to recognize in my patients' families that frustration, that, oh my God, what is going on? I can't deal with this anymore. So I started becoming a lot more sensitive to not just my patients, but also what the dynamic of the family is, how important it is to make sure that everybody that is caring for this person is well mentally and emotionally and physically. And so people started recognizing, started saying, well, I have a grandmother. Then they're like, oh my God, you do. So then, started building that rapport even more. Little did I know that very, very recent after she died, she passed away, I started really noticing that I was having a lot of symptoms. I had noticed already that I was, having trouble with my handwriting, which had gone really atrocious because I was having a lot of writer's cramp, and I was having some focal dystonia. And so that was already, been going on since I was in my residency years, which I didn't, really realize. I just thought, overworked and things like that. And I was having some visual problems even then. And again, thought it was all, just I was strange and strange bird like always. And, and so it didn't really, was busy building, career and things. So didn't really pay much attention until my grandmother died. And then I started realizing that when I was doing my exams, and you all know they have Parkinson's, the UPDRS, finger tap, open and close hands and walk in tandem. And suddenly I couldn't do that either. And I was looking at myself like, oh, wait a minute, I'm having just as much trouble. So I wasn't looking at the patients anymore. I'm like, I can't do that. And, but on top of that, I was going to the bathroom like a million times a day. So, and I started to really fall and have a lot of problems. So I was the one using the bars in my office, so it's like, okay, something's not right. And so I knew very, very early that I have Parkinson's, but since I was young and, I was still in my 36 years of age. So, I was really young and being Hispanic, and, I had all these other things going on. And plus I had a lot of pain and a lot of visual problems, which being a specialist, that was not part of the, the criteria. So I kept thinking, well, I know I have Parkinson's, but what's all this, stuff? So like everybody else, had to go through all these doctors and, all this tests and everything. And I always say I've had every test done short of a brain biopsy. So, I can pretty much tell you about everything. Thank God I didn't do a brain biopsy. I'm not sure what they would have found. So, but yeah, they, and of course the sad part was that, I was very, and me, those of you who know me, I mean, I'm very happy-go-lucky, very cheerful, very talkative. Patients love to come see me because they would get a hug and a kiss and we would talk about their family and all this. But suddenly I was so irritable. I just did not want to deal with anybody. Patients would come in and I was like, get out of my face, like that's not, go away. And they're like, we came to see you for a hug and you didn't hug us today. It's like, oh, I'm sorry. And I hated to be touched. I was in so much pain that I couldn't stand anybody touching me. And so it became really, really hard. And I was just like, my staff of 10 years, they were like, what's going on with you? She's not like this. She's not herself. What's up? And I didn't understand why I was so short tempered and so irritable and everything bothered me and everything was just like, go away, leave me alone, and come to find out it was all the Parkinson's that I was having a hard time already beginning to multitask. And, when you're a doctor, I mean, you have 20 things on your burners and being a neurologist is even worse because you have all the elderly patients and patients that fall and patients that have seizures. So the EMS and the firefighters and the police knew me very well because they were always in my office, rescuing somebody, so when you're dealing with all that continuously, I mean, it was very, very stressful. And I couldn't sleep anymore. I mean, I was always been a night owl, but then suddenly I just couldn't sleep and I felt so worn out and fatigued. And I was like, I've been doing this. This is all I knew. Why am I so tired? I mean, and then of course everybody started saying, well, it's because, you're grieving, you lost your grandmother, you're overworked. And then I said, no, I think I have Parkinson's. They were like, oh, you're just identifying with your grandmother. And, you're just, you need a psychiatrist and, all this. And I'm like, okay, I don't think I need a psychiatrist, but maybe I'm a little depressed for my grandmother, but I don't think that's going to make me think that I have Parkinson's. So anyway, so this went on for 3 years. Saw every specialist under the sun, even as a physician and a specialist and a movement disorder. I went to 2 other movement disorder specialists that told me that this was not anything, and I was a little like, okay. And finally, after 3 years, I was so exhausted. I had cut down my practice hours. I was, I couldn't really handle taking care of my daughter because I was in so much pain. I was just so irritable, and it was really hard. It was hard time, and I was having a hard time driving. I even trying to park between 2 cars. I had such a visual field deficit that I had a hard time parking between 2 cars. And that one day I actually hit drug rep's car as I was parking in because I could not see it. How far it was, and I was like, oh my God. So fortunately, the drug rep was very understanding. I went and I said, like, I just hit your car, not on purpose. I'm not mad at you.
Can I have some more samples?
Exactly. So, yeah. So it's like, and so then, we took care of that. But I said, okay, obviously something's wrong. And everybody kept telling me, your vision is fine. Your vision is fine. I'm like, I'm running into things, running into walls, can't drive, but yet my vision is fine. So something's there. So finally went back to one of my old professors and mentors and who I trust a lot. And I don't know why I hadn't gone with her initially. And I said, Maya, I said, something's not right with me. I said, I'm really falling apart. And you tell me what it is. If you think it's all in my brain, then I'll go see a psychiatrist. Okay. I said, but I don't think, this was going on. So she's known me, she's the one that, I did my residency with. She was in my wedding. She knows who I am. She's known me for years, so she looked at me, she goes, you look exhausted. I said, I am, I'm just like so tired. And so, she did all these things. And it's funny because I kept asking everybody, will you just give me some dopamine and see if I improve? And nobody would like, of course, I didn't want to write it for myself, and so I tried all kinds of other stuff, and which only, drug me and things, and could not function. So she diagnosed, she said, it's not in your brain, like it's in your brain, but not like you think. You're not, I think you have Parkinson's. And I was like, that's what I've been thinking. But then I was like, well, how about this vision and this pain? And we're like, we don't know. Neither of us were like, okay, well, let's treat the Parkinson's. And so she gave me medicine, and lo and behold, it's like, oh my God, my muscles already, felt normal, and I was thinking normal, and I was like, wow, I do have Parkinson's, So, but then I was really shocked, and so was she, that all of a sudden with this treatment, my pain improved and so did my vision. So it's like, hmm. So, that kind of started all this, trickling of, knowledge and ideas that there's a lot more we don't know and understand. Here I am a specialist, here I am, doing this. And I started thinking about my patients, start thinking about, people that had complained about visual problems, not very often, but, had complained about it. And, pain obviously, but pain usually was more in, in the middle end stages, but I never really, paid attention early on. And so stuff like that. And so here I am, 30 years being a doctor and, half of the time being a patient and a caregiver. And I decided that once I had to make that hard decision of giving up my work because it was just so hard to do multitasking, it broke my heart. And I sat there in my car in my office crying, thinking, now what am I going to do with the rest of my life? I mean, I spent all these years training, and I don't know what else to do. And that's who I am. I was always, Maria, Dr. De León is like, what am I? Is that my identity suddenly is lost? And so it took me a while to really, understand. And again, it's my husband that, that I was sitting having a pity party, one day at a restaurant, just crying, like, what's my life going to be like? Even though I knew, like, okay, I know what Parkinson's is like and, all that. First, I was like, oh, yes, I have Parkinson's. I still know what I'm talking about. And then it was like, oh, God, I have Parkinson's. Like, and so then, because I was in my 30s, it's like, what's my life going to be like? And so then I knew what I had to do. Of course, I knew the medicines. I knew what I always tell my patients, go and, do therapy and do all this. But, it was that stigma of, do I tell people? I mean, I had no problem telling people I was taking care of my grandmother, but it's different when you're the doctor and, it's like, what are they going to say? Are they going to stop seeing me? And that was a struggle. And I finally started telling my patients, but lo and behold, it was not my patients that gave me the problem. It was the boards. When I decided that I needed to cut down my hours. So, we had to have some changes in my insurance and all this stuff. And being honest, I don't even know, I should have, if I never would have said anything, then probably, I never know. But being honest that, I have a neurological condition and, and so I want to limit my practice and things. And suddenly I was in this, witchcraft. I felt like, that I was, being labeled as a drug addict, rehab category, that I had to be monitored because I had a neurological condition that I had no control over. And mentally I was fine. I mean, irritable, but fine. But once I was on the medicine, the irritability went away. So that was the thing that I noticed, that wow, this irritability, just like take a little dopamine and there's no more irritability. So it's like, so but yeah, so I had to go for a couple of years under scrutiny, and fighting the insurance and fighting the boards and stuff about that I'm able to practice. I'm not, incapacitated. And this is the people they're supposed to know better, the medical, staff. And here they are treating me as if I was, having a condition that I, conjured up on myself and decided to go seek. And so that was very, very hard. So put a lot of more undue stress, obviously, every time that, you always worry about malpractice as a doctor. And then on top of it, having this hang over you that, you have an illness, and are they going to hold it against you that, that if you did something wrong or somehow somebody complained that it's because you're on drugs, or, medication, or you're, or something. So that was very, very hard. So that was one of the things that kind of pushed me to really retire earlier, is just so much stress.
Well, and I think you definitely are relating to probably some of the people in our audience that, not being understood part, trying to be able to communicate. Carl, do you want to chime in about that?
Well, I saw 9 different doctors over 6 years to get my diagnosis, and I was just curious when I got my first inmate. it clicked within like a few, within a day. How about?
Yeah, it's like a
that-
light switch came on and like all of a sudden it's like, wow, I haven't felt like this in a long time. It's like, I didn't know how bad I was, you know? Like,
Yeah.
yeah.
Well, and I think a lot of people can really feel what you were feeling about the fact that, you know, your colleagues didn't understand. They didn't want it. They had very little, in some ways had very little compassion for you as a patient, but also as a colleague, which is
Yeah.
astounding to me, since
But
supposedly
yet they had complete confidence in me as a doctor, because they were like, just get back to your job because you're good at it and, you know, take care of your patients. But then it's like, why don't you trust me that I'm telling you that I have the problem?
right.
So, but
I've
they're
read
like,
all the books and
I know, but no, they're like, yeah, just get back to work and quit, like acting out kind of thing. And it's like, I'm really not trying to get attention here. I'm really trying to, I miss my patients. I love my work. That's what I do. And so, and it was hard. It was hard.
Well, Maria, a question that's kind of popped up in the Q&A, but I'll change it just slightly. I hope I encapsulate your entire question. But when you look back now, did you have symptoms even before?
Oh yeah, like I said, I was having symptoms in my residency in my 20s when I was doing my residency. I mean, these visual problems were come and go, and it was always when I had been on call for days and hadn't
No
slept.
sleep,
And I noticed,
stress.
yeah. So I mean, I would notice that they would, and I was teased because I always would start, and I might have mentioned this to you before, I always would start my notes in the middle of the page, and they're like, "Why do you always start your notes?" I'm like, that's why I see the margin. I don't know. And so it's like, so everybody was like, oh, there she goes, right? And why can't you start at the, and now when I started really having my visual problems consistent, I realized that was that visual field defect that I was already having, that, I couldn't see that part. So I was always starting in the middle of the page,
Well, and I will jump in for Carl if he doesn't say it. You can back me up. But even Carl's early symptoms, he had he had a lazy eye. That eye would drip. Even as a small child, he had that particular visual problem. And a little, as you've gotten older, depth perception has been
depth perception. I mean, that was one of the things that I had difficulty being on call at night because I could not judge distance anymore. And so I almost got run over by an 18-wheeler because I just could not judge how far he was traveling. And so that was very difficult. And again, I kept going to the doctor and saying, I can't tell distance at night. And they're like, your vision is fine. I'm like, well, I'm almost dying every time they call me, in the middle of the night, because I don't know how things are, how far things are. I even wore prisms for a while to try to help with that. I helped some, but didn't help with the distance wise at night. And so, so I too struggled, like I said, and so I probably dealt with that for about 3 years. I mean, for the diet, while I was having all this workup for the diagnosis, I mean, I kept going to several eye doctors to try to figure out, and everybody was saying your vision is fine. The other thing that I noticed that part of made the vision worse is that I have a mild torticollis, so my head wants to kind of tilt, and so if I'm stiff and everything, so I can't really turn. So then, it's kind of, so that compounded the whole thing. So, but, nobody, picked that up. And, until my doctor, she's like, your left side, because it started on my left side, even though I'm right-handed. She's like, your left side is kind of stiffer and it's kind of torn. I'm like, yeah, I feel it really like, it wants to kind of, it's easier for me to, my husband always said, why do you always drive on the far end of the lane, instead of like, that's the passing lane. I'm like, because it's easier for me to turn to the right and merge than it is for me to turn my whole body to then, try to merge the other way and see where the cars are coming. Because, because of the torticollis. So it's like, I just use that. I mean, yeah, you're not technically, but it's like, it's easier for me to drive. I'm going to drive than having to keep looking or be in the middle and then try to look at both sides, when you're really stiff on one side. So, you have to make adjustments.
Dr. DeLeon, there's a couple of questions that I'm going to try and combine, but
Uh-huh.
Did you experience any impulsive behavior
Uh,
as a result of your Parkinsonian meds?
yeah, I'm glad you asked that. It's funny because I've always believed in treating, the brain is a very, um, what's the word I'm looking for? It's a very complex and very well-oiled machine that God has given us. It is so, the intricacies of it, we still haven't even, touched the surface on. But I know that everything is in perfect equilibrium. And so when I manage Parkinson's, I always try to maintain that equilibrium as best I could with what we have and what we know. So that means a little bit of drugs, of different drugs, multiple drugs to act on different receptors so that we're not tipping off the balance one way or another. And so in my practice, in my personal care of my patients, I hardly ever saw anybody with OCD behavior. Since I've been with Parkinson's, I have had, I've been on that same kind of regimen on multiple medicines, small doses. And so I never experienced that until recently. I've been on Nupro patch for, over 10 years. And I've been on, Cinnamid and dopamine and all that. But I was having some issues with my Ritari, which is my dopamine medicine. And so I had to cut back on the dose. And I started noticing that when I would cut back on it, then I suddenly would have some OCD symptoms of my symptom. Everybody's different, what makes you look or do for things, because we have to think of it as the dopamine system is a reward system, and how we maintain that dopamine is the outcome, the reward. And all of you who have Parkinson's know that, and I've heard it a million times, and I used to hear it in my practice, and now I hear it from my husband too. Why is it when they're at home, they don't do anything? They just sit there doing nothing. They don't, feel like getting up, go anything. And then suddenly a friend calls, or they go out a party, or they go out somewhere, and they're all moving and hyper and talking, right? And it's that outward reward. And so what I've discovered, that when you have lack of dopamine, I don't think it's necessarily the dopamine agonist, but the fact that you don't have enough dopamine blocking, that you don't have the actual substance. Your brain, your body looks for ways to find that dopamine. And so whatever pleasure, gives you, that's what you seek for. For me, my OCD started being like, I would just watch movies that really made me happy, watch them over and over and over. And be like, aren't you tired of them? Like, no. But then as soon as I took my dopamine, it's like, I've seen this movie, I don't need to keep watching it, so it's like, so it was a very strange kind of thing like that. And that's what I've noticed, that, I play, most of you, like, your downtime, you play Candy Crush, and so I like pass my time playing. And I've never been a gambler, ever, ever. And suddenly it's like, when I don't have dopamine, when I'm really, really down, it's like, I get impatient. It's like, okay, let's buy some coins. And then my husband's already like, why are you buying some coins? It's like, I need some dopamine, and I tell him, it's like, and it's what it is. And I think that's, it's that, as I was telling, when I gave that talk in Florida, being a doctor, being an type A personality, I was always very driven. I didn't need somebody to tell me to do something. I mean, I was the one initiating. As my disease has progressed, I need a lot of external stimulation. If I don't have enough dopamine, when my dopamine is low, it's like, everything is weighed in as to how valuable and how important it is. Okay, so, today I'm not really gonna, go out. Nobody's gonna come to the house. So why do I have to, clean up and, dress and, clean the house and stuff? Nobody's around. So what does it matter? That kind of thing. Why waste a little energy? And if I know somebody's gonna come, then all of a sudden you're moving and you're doing it, and my husband's like, oh, what the heck? But is that constant, reward? Like, how important is this? Like, the writing, that's part of why we were talking about it's been on the back burner, because it's kind of like, well, does it matter if I don't write today? No, it doesn't really matter. I mean, who's going to care? Who's going to, it's like, and so I try to do things that I have deadlines, small projects, because then I have to do it, like I'm forced to do it. Otherwise, I mean,
Well, do you
there's
think,
no incentive. And so that's what I'm saying. So that when people are starting to have OCDs with the dopamine agonist, I don't think necessarily is that you're on the dopamine agonist. At least that's my perception. I've never taken it. I mean, I'm still on the Nupro. I added the dopamine, increased that, and OCDs are gone. So when I start going back to watching my movies over and over, it's like, okay, I need some dopamine. Where's it going on? It's like.
well, and Maria, one of the questions that was posed was, how do we know if it's dopamine seeking versus ADHD? Do you
Oh
think
God, I don't know. That's going to be a whole nother lecture.
Okay,
that
well,
we
we'll
have to, yeah. Yeah, something that you and your doctor have to talk about, clinical evaluation and a lot of other things. But yeah, it's, again, the brain, our bodies are very much in tune. You know that our body always seeks what it needs. It finds a way to find that balance. Before, I was diagnosed and I was having a lot of dystonia and cramps, I was drinking vinegar out of a jar, the pickle jars, like crazy. And it was funny because my patients would come in and I was asking them, I said, do you have empty jars of pickles in your refrigerator? And they're like, yes, and me too. So, it's like, it's like the body always needs. And when I start drinking, start seeking things, like the one thing, we always talk about that Parkinson's patients eat a lot of sugar. Again, the reason is because when you consume sugar, you're releasing a whole lot of dopamine. So I again notice that when my dopamine is low, I seek for caffeine and I seek chocolate. Chocolate, but sugary things, because it gives you that boost. When I'm on good levels of dopamine, I do not crave any kind of sweets. I don't crave any. So it's not the Parkinson's itself. It's the balance of the chemicals and the going down. And so I think that that's a sign that we should start looking at it when people start really like, oh, I'm grabbing sugars all the time. Like when they took me, when I decreased that medicine and I was really trying to find the right dose and I was having all the OCD, I was drinking caffeine and eating sweets all the time because I was just like needing that boost, and then as soon as I adjusted my medicine, it's like, yeah, once in a while it's like, yeah, it's there, but it's not like you're not actively seeking it.
Well, and I think you're bringing up a very good point, Maria, that we haven't talked about before, but, for people to track,
Yeah.
it's not sometimes people say, well, why should I write that down? Why is that important? Because it's these little clues that when you only see your doctor maybe 3 to 4 times a year, for you go into that 15-minute appointment. If you're lucky, if you go to a university hospital, maybe you get a little bit longer time, but you have a short window of time to report these little things, and these little things can add up to a lot. And so always pay attention to those small details, both for the person with Parkinson's and the care partner or family members or whoever are caring for the person with Parkinson's, because these could really be helpful insights. And I always encourage people use the portals. Now that most medical practices have portals, these are opportunities to submit this information. Maybe it's not super urgent, but it's something that needs to be noted and taken care of at these appointments. Do you agree?
Yeah, I think that, it's this life changes, this activities of daily living, they're much more insightful and helpful for you to track, and also for the doctors, because sometimes, this, most of this is one, as doctors, we care about, have you fallen? Have you choked? Have you, are you mentally confused, disoriented? But we don't care, have you tidied up your house? Have you really showered in the last, how many times have you showered? Are you, shaving? Are you, folding your clothes? Are you doing laundry? But those are the things that really matter in your living environment. Suddenly, your house is a mess, and it's like, why? And you don't feel like doing it. It's because you don't have that oomph to get going. And I think sometimes that's a lot more important than, have you fallen? No, I haven't fallen. No, I'm not choking. Oh, okay, you're fine. Well, no, I'm not, because I haven't cooked. I haven't gone grocery shopping. I haven't left the house because I just don't have enough impetus to go do it, because it's not that important. So those are the things that we need to start paying attention at. What are we doing? Are we sleeping through the night? How many hours are we sleeping? Are we consuming a lot more sugars? Are we seeking, activities that will boost our dopamine? Like, are we doing more OCD things? Are we listening to the same music, listening to the same movie, playing more games, spending, even if you're not, are you shopping more? Those kind of things, because there are behaviors that are trying to compensate and boost that dopamine. And so we need to, it can be dangerous if they're not, they're not curtailed. I mean, it could put people in danger with, overspending, with, sexual activities, with behavior. And so it's something that can be corrected and found the right treatment, if you are aware and if you talk about it, and then realize that what is the underlying cause of it, what is trying to, what's motivating this behavior.
Well, and I think you're tapping into something too, that is about mental health
Yeah.
components of Parkinson's,
Yes.
but also mental health in general. And that sometimes if you can treat the brain chemistry problem, because a lot of times, it could be a serotonin problem or a dopamine problem or whatever. If you talk to someone who can help you both balance the chemical issues that are absolutely out of your control with
Yeah.
some of the finding a support group or finding a mental health professional. Don't be embarrassed to tell your GP or your neurologist or your movement disorder specialist these things, because they can be treated just as you said.
Yes.
Or sometimes it even takes a friend or someone to tell you what's going on, because you don't recognize it yourself.
Yeah, exactly. And I always encourage somebody to have somebody to keep you accountable. Fortunately, I'm very lucky. I have friends, and they're like, I haven't seen you in a while. Why aren't you going out? I just don't feel well, or I just don't want to, because you lose that drive, and you're like, and so, or I can't drive. So then, like, okay, well, get dressed, I'm coming to pick you up, or I'm coming to your house anyway, and we're going to do something. Before you know it, you start feeling better. So you need to have somebody that's going to check on you, keep you accountable. What's going on? Have you done this? Have you gone out? Have you, dressed? Have you showered? Whatever. But I always say you have to have three people, one person to cry with, one person to laugh with, and one person to kind of, lift you up, and listen to what's going on. And usually it's not the same person, usually you have different people you call, that, hey, I'm feeling out, somebody I have a friend that has a lot of chronic illness like me. So we commiserate when we're like, oh, when was the last time, talk about this and that. And then, when you want to just laugh, you call, somebody. And so, so it's good to have that. But on the note of mental illnesses, I really want to make a big point about apathy and depression. Apathy, I hate that word, but because in neurology, it really connotates a bad thing. And usually when I think of apathy, I think of dementia, I think of Alzheimer's people, I think of other things. Apathy in itself, what it means is like that you don't care about anything. Okay, but I don't think that Parkinson's patients, when they're quote unquote apathetic, and I know when I say that, when people say, oh, you look apathetic, it's not that you don't care. And that's where you have to make the difference, is the distinction of what's going on. It's not that you don't care about getting dressed, about the house being looking nice, about cooking. It's just that you don't have enough impetus to get going. It takes so much energy to start that process. And is it worth it? And that's where you do the is it worth it part. Well, is it worth it for me to really get going and go do this when, nobody's going to care if I don't do it? That's where the apathy is. Okay. And that's why that's a pure lack of dopamine. So I want you to know that pure lack of dopamine. When you are not getting dressed, you're not getting the things you need to do because you just don't have enough to get it going. That's dopamine. You need dopamine. If you, on the other hand, say, I just don't care what I look like. I don't care. I don't want to go anywhere. I don't want to do anything. It doesn't matter. That's loss of interest. And that's depression. And that is a serotonin problem versus a dopamine problem. So that's why it's very important to know what is it that is driving you. Like if I'm just sitting here like, don't want to change. But my best friend calls me, says, hey, Maria, we're having a party. I'm picking you up. I'll be up in no time. I'll be like, okay, I have no problem getting going. But if nobody calls and I don't have to go anywhere, it's like, I'll sit here in my, my stretchy pants. It doesn't matter.
Well, go ahead.
Some of us are procrastinators. So when is procrastination and when is it apathy?
Well, that's part of the thing, that the procrastination can be part of that apathy, that you procrastinate. Look at why you procrastinate. Is it because it's going to use up so much energy? It takes you so much mental ability, so much physical energy that it's like you get tired even just thinking about it. And so it's like, well, it's not really important. So I'll do it the other day. I mean, that's what I do with the writing and things that are not important to that. There's no deadlines or things because it's like, whatever gets done, it gets done. I mean, because you're not going to be like, oh, you were 5 minutes late on this deadline and you're not going to get paid. That's different, but if somebody, it's just something that you want to do, but it's like, so that's part of that initiative. And then suddenly, I mean, I don't know about you, but I know for a fact that as soon as I take my dopamine, it's like a switch goes on in my brain. And it's like suddenly like, whoo, it's funny. I tell my husband, I could be sitting there kind of like, look at the house, whatever. And then suddenly, you take this dopamine. It's like, oh my God, that door hasn't been cleaned. Oh, that, that thing needs to be vacuumed. And, it's like all of a sudden you're like looking at everything, So.
Well, and Maria, I wonder if you can comment a little bit about what it's like to, because of your the facets that you have of living with Parkinson's.
Yeah.
For our care partners, I'm shouting out for the care partners on the call or on the video. How do you think it's best for a care partner? I will use my example. Sometimes I have to cue Carl to do certain things like, okay, well, now we're going to do this, this, and this. Like this morning we had I confess, we had some piles of clothes that you put away from the laundry. Yeah. And I was like,
you don't want to come to my house and do that. Yeah, you don't want to come to my house. I have lots of piles of clothes to be put away. So.
Well, besides the volunteering obligations and work and all that. So, but we did, once we tackled, it was like, I'm bringing the coffee, we're doing the laundry. And it was like, both of us, we got it done.
It was the coffee that did it.
It was the coffee. No, it wasn't.
Yeah, there you go. Yeah, it's.
How do you cope with the, these ups and downs? Like, oh, they feel like everything's great.
It is hard. And my husband, probably could tell you that, living with me is a challenge. We just had our 25th wedding anniversary, and so he's like, feel like 100,
Some days, yes.
Some days. Well, in general, and the thing that I had to learn as a patient that I had to learn was that, when I was feeling well, I was wanting everybody to be ready to do things because then I was ready to do things. And so kind of having them on standby, and it's a horrible thing to be on, you know, and I'll be like, but I'm ready now. And they're like, well, you know, we're not. And it's like, but, you know, but I've only got a little time window. So, you know, we got to do this.
Yeah.
And I want to do everything. And so I had to learn that, you know, it's like, we have to really, find a happy medium, because then he went the other extreme. Like, you have to tell me in advance what you want to do. I'm like, I don't know what I'm going to be like in 5 minutes, in an hour. It's like, you know, that's crazy. And so we had to, you know, kind of work each other's, you know, way. But I think the best thing for caregivers, that I see a problem, or not a problem, but it can lead to problems, is that, you know, when you first get diagnosed, if you have a caregiver or a loved one that is really, you know, loves you and cares for you, wants to do everything for you. They want to, you know, be there for you at every doctor's appointment. They want to do everything. And that's awesome. However, it one takes away the independence and of both people. You know, you have to maintain independence of each other, you know, and still have dreams of each other, and then come together as goals. But what happens that I see all the time, because this is a marathon, this is not a sprint. When you get to the, you know, 10-year mark, 15-year mark, when the patient really needs the help and it starts to go down, the caregiver is burnt out, is exhausted, no more. 10 years of this, you know? So I say, let them be when they're initially, yes, go in when they need help. I mean, my husband and I mean, I go to all the doctor's appointments, I do all this, but when I can't drive, when I'm really sick, then either I try to have a friend go with me so my husband can continue working, so we won't take his work away from him. But if he's available, yes, I like him to come. But I ask him, do you want to come? I mean, you don't have to. I manage myself. I mean, it's fine. But if you want to come, and sometimes, you know, yeah, you haven't told him this, then I want to be there. And I appreciate that. But he's not like there taking care of every step. But I realized that he does a lot behind the scenes. And so that's the thing, that when he got sick and I almost lost him 2 years ago during the pandemic, I realized how much he does for me behind the scenes and lets me do all these things I do, you know. So it's like, you know, suddenly it's like, oh my God, you know, he's been taking care of the finances, he's been taking care of, you know, he takes out the trash every day, he takes out, you know, like he goes to do, you know, he buys the, you know, whatever his stuff. And it's like, oh my God, you know, so then you realize, so it's important to have those rules and in that independence, and come together and give them, because everybody focuses on the patient so much sometimes. And so the caregiver kind of goes behind. And I know that from taking care of my grandmother, you know, for all those years, like everybody was focused on her. And the caregiver gets worn out, especially if somebody is needing attention 24/7. You know, you get extremely exhausted. And so save that energy, save that time to when you really need it, when the person with the Parkinson's really needs your help. If they're able to dress themselves, feed themselves, go to the doctor themselves, do those things, let them do it. Yeah, if you know, their memory, whatever, you know, follow by, but try to find ways to still have that independent life, because I think that that's one of the biggest things. I don't know if you saw that documentary about Alzheimer's. It's the same thing. There was this couple they were following on TV. The wife got diagnosed with Alzheimer's, and I think they followed them for like 5 years or 6 years, something. And initially, the husband was so doting and giving and everything, and I mean, it was wonderful. But when she really got demented, he was exhausted. She couldn't take care of herself, and he couldn't take care of her, and he couldn't take care of himself either.
Yeah.
So, you know, you don't want to end up in a situation where you both, you know, need an assistance or help. And so that's why I always try to say, yes, it's good to have somebody to support you and to talk about and plan. And it's always good to see it from the other person's perspective, because the one thing that I've learned too is that we all adjust differently. Like, I could be in a completely acceptance stage, and lo and behold, my husband's still in denial. And it's like, wait, I thought we've been dealing with this for 15 years. How are you in denial? You know, it's just like, and so you have to deal with that every time something changes, you're each going through the same process, and it takes different times to be able to reach the same steps. And so you have to give that person that space and talk about it. Communication is the number one thing. Communication, communication, communication. Find out, even if they make you mad, even if you make them mad. I mean, we were talking about this morning. It's like, I live living with you. Yeah. And the fact that, I've been sick and I'm going to go speak in San Antonio. And he's like, I'm having to drive you. And why are you doing this? That kind of thing, and it's like, because I can't drive myself. And I'm like, and so those things that you have to be honest, brutally honest sometimes. But if you have a good relationship, it's only going to get better with the communication. Otherwise, it's very easy to fall apart. If especially if you try to take care of everything, you get overwhelmed.
Well,
And especially if you have kids and you're in the middle. Yes, go ahead, Carl. Yeah,
you're so right. I mean, Parkinson's is a moving target. So
yeah.
So as things change, you got to stay in contact and where your partner is. Because things change.
Yeah.
And sometimes I just ask him. I mean, it's not, sometimes I think I'll cue into what you said about losing your grandmother and all that.
Yeah.
Grief. We just lost some very important people in our lives towards the end of the pandemic. Grief can play havoc. So sometimes I was like, I would be annoyed to the point of annoying, saying, how are you? What's going on? Because he would be quiet and he wouldn't say anything. And then I think those are the times you have to find different avenues to kind of get to the root of what is bothering him, because obviously with facial masking, you may not see it on their face. You've got to probe.
Plus during the pandemic, we were wearing masks all the time, which
exactly, which you can't see. Yeah, I know. No, it's the same thing. It's like I said, when my husband suddenly started going like, saying, you need to give me, 2 days notice for things. I was like, what is going on? It's like, I don't know what my life is in the, minute from now. And so first it was like kind of annoyed and getting mad and like, well, what's wrong? Don't you understand who I am? And then it kind of had to step back and say, okay, where's this change in behavior coming from? And sometimes, again, we act to protect ourselves, or, he started going under a lot of stress because I was getting sicker, and then, daughter and parents and everything. So I had to say, okay, what's going on? And then, when you talk about it and realize what the source is, and then you can, work at it. And then it was, makes a lot more sense. It's like, okay, I'm going to try to be, more, sensitive to your needs, and you become more sensitive. You can't expect me to tell you what I'm going to be doing tomorrow at 2:00, and so, stuff like that. So yeah, it's a lot of communication. And again, if it wasn't for my husband that is, keenly observant of my behavior and knows me, I probably, I got suicidal with medicines. And I was just like, and again, you see me, I'm a happy person. Suddenly I was just crying. And it's the first time ever. And it was scary because I really wanted to die. And I was like, where is this coming from? And he looked at me, goes, okay, what's up with you? He goes, nothing lets you down. I mean, you've been through all this, and you laugh at it, you get back up, and he goes, but what is going on with you? And he knew that I was not being myself, that something was off. And so fortunately, we're like, still had enough wits to think like, well, what's changed in the last, week? And again, that's why it's important, those diaries, know what medicines, and do one medicine change at a time, because then we realized that the only thing that changed was that medicine had been added. And so we're like, well, let's stop it. And lo and behold, stop it, no more, thoughts. So it's really, really important to know what your partners are taking, and also yourself. Like, always make one change at a time. Never do more than one change, so that you know exactly what happens when you take it, how long does it take to kick in, how long does the effect last, and when symptoms start, you know what it is. and always have the 911 number and your doctor's number and find out that what happens if I have any problems, who do I call, where do I go, so you need to know, especially if you live alone and stuff. I mean, we
Right.
don't want things like that. So tell somebody. And know new medicines if you live alone. That's usually like I told when I started my sleeping pill. Okay, I'm starting a new sleeping pill. Make sure that if I do anything funny tonight, or like make sure I'm okay. So let somebody know, so that something that could be potentially dangerous, or not dangerous, but could potentially have harmful effects, people are aware and know to check on you and be aware of what's going on. And so that's why I always recommend for the partners and the people that have the disease, to let people know that, hey, I'm on something new, just so that.
Maria, I'm gonna jump in for just a second. We've had some excellent questions that were submitted ahead of time. Are you okay with? I want to kind of stay with
Yeah.
the discussion
yeah.
that we're on. We'll get back to these people outside of the webinar, because we are coming up on. We have like 3 minutes left.
Yeah,
There's
I'm
a lot
sorry
of
I
questions.
talk a lot. I'm sorry I talk a lot. We just
No,
enjoy
no,
this.
don't
It's
apologize. No,
great.
not at all. It's all great.
Great.
And but I just want to kind of let our we
Yeah.
had somebody post in the chat who had submitted earlier, and
Yeah, and we can talk
we'll
about
work
it.
it
We can send the answers to them.
okay, let's
Thank
do
you.
that. I want to go back for 1 second and talk about the resilience part, because I think it might be an excellent place to kind of wrap this whole thing up. Could you Carl and I know that you're that kind of person. You have these challenges and you bounce right back, and you're serving the community in so many different levels. How do you keep the resilience? I mean, what
And you're always so
you're
upbeat.
so positive and so resilient. Can you kind of talk a little bit about where
Well,
that resilience comes from?
I think that yeah, my husband and I were talking about that earlier. I think first of all, it comes from my faith in God. I have strong faith. So I know that everything in the end will work out. But you know what? The reason I did this, I guess, one, I've been through a lot in my life. And so I always think, and that's why I encourage people to always think of the things you've overcome, the challenges you've been through, how far you've come. When you feel like you can't go anymore, think of that time that you thought you couldn't do something and you did. I think about, when I was in medical school, and some people say, oh, you're never going to, graduate because you're Hispanic or you're this or that. It's like, and you did it. And so you think about, if I can do that, I can keep going. And so you think about stories in your life that you've overcome, how big or small, and they should give you energy to keep going. And that's why it's important to own your story, to tell your story, to share your story, because it empowers you. But also, like I said, faith. It's always good to believe in something greater than you, great outside of yourself. And nothing made me more sad in my patients when they died alone, or they had nobody, or had no beliefs. And that just broke my heart. And I was there trying to be there for them, for my patients. I'd never want anybody to be alone. And that's part of what I do, to bring hope to people, because life is full of challenges. I mean, whether you have a disease or not, and things change, and it's always the unexpected. You worry about a million things, and it's always what you don't see coming that happens, right? Like me getting Parkinson's at 36, right? So it's kind of like that. So you have to learn to roll with the punches, but also know that there's something better, greater, because that what keeps you going, something to get up. That's why you have to have a passion, of reason to get up. What makes you get up and go? What makes you fight? My God, my daughter, my husband, and of course all of you, all of you make me, have a reason. And sometimes, yeah, I get down like everybody else. You get tired physically, and you think like, well, I'm not making a difference. What does it matter if I stop doing this? Nobody's gonna, it's like there's a lot of people doing this. And then somebody will call and say, you really touched my life, or you said something, and you're like, oh, and then you're like, okay, maybe I do have a purpose. And so then you get up and go, and so sometimes you need that. And and it's funny, God always puts that, like when I was, in practice and I was thinking about quitting and this, and you're like, well, maybe, being a doctor really didn't make a difference. And then somebody would come in from like years. So like, oh, you diagnosed my cancer and I'm better and or something. And it's like, you don't think of people's lives you touch because, there's all these people out there, but everybody's looking. And so think about doing and giving to others what you want others to give you. And you will always give more in return than what you give, always. I mean, so always keep your hands open and look for ways to keep persevering. And I always think of that story, which is poignant. It was a lady, and I don't remember her name, that she wanted to cross the ship channel, and she rowed and she rowed and she rowed, and at the last second, because there was so much fog, she couldn't see the end, and she stopped rowing, and she was only like a foot away from the thing. And so you know how devastating it is to give up, like when you're right there. And so always take time, listen to your emotions. If you have to cry, if you have to take a day off, and that's what I do. Sometimes you just feel tired. You need your brain to shut down. You need your soul to be nourished. You need your emotions. And you say, I'm just going to curl up here and not talk to anybody, not do anything, take care of me so then I can take care of others. I mean, I just think of it, again, being a religious person, think of, even God, Jesus, who is God, needed some time alone to fill up and to be able to continue. So much us, we're humans, and so we get tired and we get weak and we get despondent and depressed and things. So we need to have somebody nourish us as well so that we can continue. So it's not easy, but if you have somebody, Carl and Angela, you have each other, it's wonderful. I'm lucky to have a husband that loves me and takes care of me. And so, yes, somebody that supports you. So find that support, whoever that is, a friend, a spouse, a child, find that person that lifts you up. And so that will be there for you when you need that, and you feel like you just can't go, okay, take a break, rest, but just don't let it be too long. Don't stay in, forever. It's okay, a day or two, we all need our bodies to replenish and, heal, but then just get up and say, okay, sometimes I say one breath at a time, 1 inch at a time. I mean, sometimes it's all you can do. I mean, sometimes you just go like, I don't know, you can't think about the future because it depresses you. And so I don't like to think about that. When you have thoughts that, negative thoughts, stop them immediately and think of something positive. And that's the way that at least I managed to do. So.
Well, you've given us a lot of gifts today and a lot of positivity and a lot of things to carry us on no matter what our journey is. Carl's holding up your book. Go ahead.
Thank you.
Diva. For all those who did submit the questions, we will work with Maria and get you those answers. So don't feel like I hope you don't feel like that we didn't.
Yeah, no, we will
your
answer you the questions. Yes,
but you were on a roll, Maria. So
great.
Thank you so much for your time today. Thank you for
Thank
giving
you.
those gifts. Any comments?
Thank you, everybody, for being here.
Yes, thank you. I want to thank everybody, and thank you, Maria. It's always a pleasure. It's
Likewise, likewise. Thank you. Somebody said love the book. Yeah,
Yeah.
thank you so much.
We
Thank
got
you.
a few of those comments, and
Yeah.
Somebody even talked about that they got their library to purchase it for their community. So
Oh,
that was
thank you
great.
so much.
So
Oh,
thank you so much for your
Love you.
time. David, any wrap ups from you? Just so we make sure, any housekeeping items? He didn't unmute. Go ahead, David.
There really aren't any housekeeping items. We'd like, on behalf of the board, we'd like to thank you for taking the time to join us today. And there aren't enough words to express our appreciation for Dr. De León in terms of the wisdom she imparted and her willingness to share her personal experience. Part of the mission of PSN is to facilitate the sharing of experiences and the sharing of how Parkinson's has affected people's lives, of both people with Parkinson's as well as the care partners. I think today's session certainly provided a very important context on Parkinson's disease. And I cannot begin to imagine how somebody who went through the training to be a physician, to specialize on a particular disease, then to be diagnosed with that disease. It's just an incomprehensible sequence of events. And I really felt that as a result of today's session, we have a great deal more insight into what that meant for you.
Thank you so much.
Thank you so much,
It's an
Maria.
honor. Thank you.
It's
God
it's
bless
our
all of you.
pleasure. And
You
have a
guys keep
wonderful day.
doing everything with what you're doing.
You
I
too. Take care, everybody.
All right, thank
we'll
you,
see
everybody.